This video is for basic facial, and we start the video as we always do. Just as we arrive to work, we wash our hands. So we're going to go to the sink, wet our hands, get a coin-sized amount of liquid hand soap, wash our hands down to our wrist. We're going to wash the back of our hands down to our wrist. We're going to wash our fingers. We're going to wash the back of our fingers. We're going to wash our fingertips and our nails. We're going to wash between our fingers and our thumbs. We're going to wash our thumbs, and we're going to wash our wrists. And we're going to do all of that interlocking wash for a minimum of 20 to 30 seconds. And when we feel like we've gotten everything really clean, we're going to rinse thoroughly under the sink and running water. And then we're going to grab disposable paper towels or a towel, and we are going to turn our faucet off, dry our hands off completely, and then toss our paper towels into the trash. If we used a towel, we would put it in a closed container until time for laundry. And then we will grab our hand sanitizer, 70% ethyl alcohol, and we will hand sanitize just as we did with our cleansing step. And now it's time to prepare our space for the basic facial. So we're just going to review what we would do prior to our client arriving, and you want to do as much as you can before they get here because you want to be professional, you want to be mindful of their schedule and your schedule. So you would do everything you possibly could before service would start. That way you could be giving them their time for the service and not a setup time during the service. So you're going to disinfect the workstation, bed, and equipment using a disinfectant wipe and following manufacturer's instructions. You're going to check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. You're going to gather clean supplies needed for the facial service, storing in a clean, closed container. You're going to turn on the hot cabbie and stock with at least 3 clean wet towels. More may be needed depending on the service and the client's needs. You'll fill a clean steamer glass with distilled water and preheat the steamer. We'll dispense products needed for the service according to skin type and client's needs as follows. You'll prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or remove the product with a disinfected or clean single-use spatula, close the lid to the product, and set the portion cup tray on the tray. You're going to drape the facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place clean, laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and headband on top of the first towel, along with a rolled towel, to support the head and neck of the client. Save the third towel to lay across the client's décolleté. So if we've already done all of that, what we're going to do is just kind of review our tray that's already been set up over here ready for our basic facials. So we have, of course, makeup remover, astringent, and water. We also have toner. This toner happens to be in a spray container. We have 4 squares, 2x2s, cotton rounds, wooden stick Q-tips. We have disposable gloves. We have a brush that we're going to use to apply the mask with. We have of course, cleanser, exfoliant, we have a mask, we have massage product, we have eye cream and moisturizer. Pretty much everything that we would need to perform the basic facial. And one thing to note is if you do not know your client's skin type and you do not know exactly what your needs will be on that end, you can certainly have every single thing ready to go and just maybe have particular products based on skin type easy to dispense there. And you can make those decisions, obviously when you meet the client. So the key is to have your setup ready to go so that you can obviously stay on task with your client and your service. And then, of course, we would go into our client consultation phase where we're going to go meet and greet the client when they arrive. One thing to note is that I have clean hands. So I've washed my hands when I came to work. I would wash my hands again before I went to meet the client, but I'm going to wash them again before service starts, so we're just going to assume that my hands are perfectly clean for this video. So our client has arrived promptly at their appointment time, so we're going to go out and greet the client warmly, of course, and escort them to the work area. And we're going to do all the things that matter, like make eye contact, give a firm handshake, make them feel at ease, because the client may feel more uncomfortable if they don't know you than you would feel. So it's our job to welcome them and make them feel like they're in a really beautiful space and that they're in a safe space. So we're going to determine the client's preferences, and we're going to assess the client's needs. We're going to assess the client's skin by performing a skin analysis. Obviously, at this point, you can only look at their face. You won't be able to do your professional analysis yet, to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. And now we're going to go into some detail on some things that we're going to be looking over and reviewing with the client in more detail. We're going to assess the client's consultation form for any medications and products that they might have used within the last 72 hours and consult on any known allergies. Medications, as we know, can affect the skin, so we really have to deep dive into what they're currently taking or on a regular basis, or maybe something they've just taken recently. And if we don't know, of course, we're going to look it up, because we want to make sure that there's nothing that would change about the skin based on those medications and the service that we're getting ready to perform. We want to make sure that none of the products that we use have an ingredient in it that the client could potentially be allergic to, which is why we discuss allergies. We will consult with the client on any facial surgeries within the last 3 months, and if the client's under a physician's care, some of those things may determine whether or not we can perform the basic facial. Assess if the client is prone to cold sores or fever blisters. So if they don't have any at all, that's fine, but we want to be cautious. If there's any fever blister or cold sore at all, no service can be performed. It's super highly contagious, so just note that. We're going to assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, or hydroquinone, etc. We can't perform the service if they have, because it can make the skin extremely sensitive to any other product. So we have to be very, very careful with that. And then, of course, we're going to assess if the client's had facial injections within the last 3 weeks, like Botox or hyaluronic filler. So we need to get past that 3-week window in order for us to move forward. And thankfully, our client doesn't have any of those contraindications. So we're very lucky. She is safe, and we can move forward. So you just really want to take some time there. Make sure that if there's anything that you're going to do, this is a basic facial, so you don't have to go into deep detail here. But if you're doing some other kind of services, make sure you know things about their total overall health and things like diabetes, high blood pressure, high pain tolerance, if they've had any like metal plates, you're going to really get into the details. So if you don't know, ask, look it up, ask your client. It's super important. So our client's fine. We're going to get our client comfortable in the facial bed. So we're going to walk them into that space and then go ahead and give them some privacy. Close the door, let them change and get into the bed alone, into their drape. And then you'll come knock on the door. And when they say it's okay for you to enter, you're ready to go. So what you would do is then come in and kind of help get them even more comfortable. So you'll tuck them in. You have a towel here that you can cover the décolleté even a little bit more. We've got a rolled towel that we're going to place under the client's neck for additional comfort, and then we have a hairnet that we're going to keep her hair away from her face for the service. So we're going to put that on. And once we feel like she's good and comfortable, we'll go ahead and do a quick wash of our hands so that we can start performing the service. So we'll go to the sink, we'll wet our hands, we'll get the coin-sized amount of hand soap, liquid hand soap, and we'll wash our hands down to the wrist. We're going to wash the back of our hands down to the wrist. We're going to wash our fingers, and we're going to wash the back of our fingers. We're going to wash our fingertips and nails. We're going to wash between our fingers. We're going to wash between our fingers and our thumbs. We're going to wash our thumbs. We're going to wash our wrists, and we're going to do all of that really strong, good interlocking cleanse for a minimum of 20 to 30 seconds. Then we're going to do a thorough proper rinse under running water. When we feel like everything is rinsed, we're going to grab either disposable paper towels or a towel to turn the faucet off. We're going to dry our hands thoroughly. We're going to throw those paper towels in the trash. If it's a now dirty towel, it would go in a closed container until it's time to do the laundry. And then we're going to grab and find, of course, our 70% ethyl alcohol hand sanitizer. We will sanitize up. And once we're completely sanitized, we can begin the service, which will start now. So the first thing we have to do is remove the client's makeup. And then we'll go in for that first cleanse of the client's face. And then what we're going to do is remove that initial cleanse, that first cleanse. And now we are going to tell our client that we're going to be getting a very bright light. So I've got to protect her eyes. So what I'm going to do now is cover her eyes up. And we're going to bring in a magnifying lamp or a woods lamp. So we want to protect her eyes, or his eyes. And so I'm just covering up her eyes. And I don't have that equipment, so we're just going to pretend and talk about it. So I would be bringing in this magnifying lamp, and I would be turning it on, big bright light over my client's face. And we would be going through each part of the neck and face skin, looking all around at all the details through that light. And we're going to do this for many reasons, and it's a really important step in your facial process. Number one, you're able to really see, so you're going to be able to give that professional skin analysis. But more than anything, you're going to get a true look at your client's skin. And maybe she had a specific concern that you were looking for, but this is where you really get to see what's really happening. So you're going to be analyzing things like pore size, if there's any redness, hyperpigmentation, excess sebum, dryness, dehydration, fine lines, wrinkles, freckling and moles. You're really looking at everything on the skin. If there's any kind of like cuperose, or if there's a capillary issue, anything that you could imagine to look for, that's what you're checking out on the skin. Number one, you're going to be documenting all of this in your client card or your software system, whatever you have for your clients. But you are also doing that to not only figure out what services are appropriate, but also to be able to help support in picking the most effective at-home care regimen to support the ultimate goals that you've come up with together for their skin. So you take the time right now to really deep dive into this. And then also you really want to learn and know your client's skin, so you're going to be able to celebrate successes and improvements. You're going to be able to notice if something's going on that's not right, that you can discuss with your client, that maybe you guys can address and change out products. You're also going to be able to notate if there's a change in a freckle or a mole, if there's something that's out of your scope of practice that you could then pass him or her along to referral to a physician. All of those things are important. So this is where you don't rush through this step, and you really discuss all of those things with your client as well. It's a perfect time while you're analyzing to talk about certain things that you think you see that are really wonderful, and also opportunities that you guys can work on together. So we've done our skin analysis. We feel really good about it. And of course, we're going to put all the documentation down after the visit, but you can move forward, and then you can just remove the covering from the eyes after you've turned the lamp off and moved it out of the way. Once you've done that, you're going to go in for cleanse number 2. Just removing any extra dirt, debris, makeup that you might have seen, also important. And then we're going to, of course, remove cleanse number 2. And then now we're going to go in for our third and final cleanse. You may find that some of your clients don't need it, but our client does, so we're doing it. Once you've got that third and final cleanse done, you can remove it. And now we're going to tone. So I'm going to take 2x2s, and my toner is in a spray container, so I want to make sure there's no contact between the spray and the toner. Spray, toner, and the little cotton squares. So I'm just going to tone. And then we are going to exfoliate. So what we're going to do is we're going to get about a pea-sized amount of our exfoliant, and we are going to spread it around on our client. So we're going to put a little bit on the neck as well. And what I'm going to do next is massage in this exfoliant. Of course, I'm going to be avoiding the eyes, the nose, and the mouth, and I'm going to be massaging it in for about 1 to 2 minutes. And, you know, of course, you're going to always read and follow a manufacturer's directions. There are physical exfoliants and there are chemical exfoliants, and you just want to make sure you know what you're doing with each, and then, of course, being cautious and mindful of what your goals are for your client and you. And then once you've got everything massaged in, you're going to be going to the next step. I don't have that equipment, so I'm going to be reading through the process for you on the next thing that we would be doing with the exfoliant. So we would retrieve the facial steamer, the one that we put the distilled water in preheated ahead of time. And we would position the steamer and bring it over next to the facial bed. We position it there, making sure that it's facing away from the client when we turn it on, and we're gonna leave it facing away from the client until it starts to have that even outflow of a mist. Once that happens, you can then position the steamer about 16 inches above the client's chin. And you're going to aim it there for even distribution on the face, allowing the unit to function for 3 to 5 minutes. Then you would remove the steamer from the client's face and return the steamer to its previous location for disinfection. So we'd bring it over to the table, or excuse me, close to the facial bed, and then we would make sure it's facing away from the client, turn it on and let that steam come out, position it at about 16 inches over the client's chin so it can evenly distribute that steam for about 3 to 5 minutes. We're doing a video, we don't have the equipment, we're going to just move ahead as if the 3 to 5 minutes has elapsed. Turn that steamer away from the client, turn it off, and return it to where it was originally placed until you can disinfect it after the service is over. So that time's elapsed, and what we would do now is remove the exfoliant. I also do not have a hot cabbie or a cabbie for hot towels, so I'm just gonna pretend that part, and I'm grabbing my towel from my hot cabbie, shaking it out because it's hot. Of course, I will be checking the temperature on my wrist to gauge it, to make sure it's comfortable. And then, excuse me, I would go in and check that temperature on my client's collarbone. She says it feels great. So I'm gonna go ahead and bring it in, and I'm going to cover the face, leaving the nose out so she can breathe. And we'll let it sit there. So your hot towels are really cozy and comfortable. One thing you need to note is that they do cool down quickly. So, and within about 20 to 30 seconds, you can probably remove this steam towel. So we start to feel that coolness, so we're just going in here now to remove the exfoliant product, and you want to make sure that you do get all of it. Remember that you put some on the neck as well. You don't want it to continue to exfoliate as you move forward, so you want to make sure that you get every last bit of it off, and you can always check in with the client on comfort level, etc. If it's you know, a spicier one and they really feel it, we definitely want to make sure that you're getting it off there. And once you do have that exfoliant completely removed, you want to make sure, without a shadow of a doubt, you get your hands nice and dry, because you, if needed, you will be performing extractions at this point. And my client has a couple of extractions that I need to do, but it will not require a lot. However, you do have to wear gloves for this next step, disposable gloves. So it's difficult to put those gloves on with wet hands. So I'm going to put my gloves on now that my hands are dry. And the other thing I'm going to do is I'm going to cover my client's eyes back up, because I need the light to really work well to perform these extractions. So I'm going to bring that magnifying light over, really just for the brightness, but I don't want her eyes to be hurt, so I'm going to tell her that I'm going to cover your eyes again just for this part of extraction. So let me cover those eyes up so I can turn that light back on. And I bring the light over and I turn it on. Now there's a couple ways that you can perform extractions. You can use 2 cotton rounds soaked in astringent, and you could certainly have them wrapped around your fingers and working your way around as you perform the extractions. You can work your way around the cotton rounds and then toss them. I'm going to use the wooden stick Q-tip method. And so for each extraction, you soak in astringent and then remove and then toss. So she doesn't have many extractions to perform anyway, so we're just going to do this route here. She's got a couple on the chin that we want to address. And once you do your performing extraction, you're going to toss it. A little more. And that concludes that. So we're going to go ahead and take off these disposable gloves, toss them. Turn that light off, take it out of the way. And then once your gloves are tossed, you can remove her eye coverings, because the light is now off. And you'll move forward. So what we're going to do next is we are going to tone. And be mindful when you're performing your extractions, you don't want to do that any more than 5 to 7 minutes, because it can be uncomfortable for clients, especially if you have more extractions than not. So you want to make sure you're just kind and doing what you need to do. Obviously, you want to perform them if they need to be performed, but you want to make sure that you don't make your client so uncomfortable that it's just painful. So you just do your best, but don't make it go on too long. And then the next thing that we're going to go into after we do this tone here, of course, is massage portion. So if it's someone with a severe case of acne, obviously you would not be doing a bunch of massage or performing that part. Your facial would be focused on other things anyway. So just note that massage and severe acne do not go together. Excuse me. Little tickle there in my nose. Okay, so we are going to do the massage portion, and we're going to be really mindful here that once we start the massage, we don't want our hands to have to leave the client. So we're going to get enough massage product before we even begin. And then we're going to kind of spread it around on our client before we even start, so that as we move throughout this portion of the facial, that our hands will be able to stay in contact with our client and not have to go back and forth to the massage product or leave them while they're enjoying this amazing, relaxing time. So just be mindful. That's the one note on massage that we always want to think about, is that it's best for the client. It's most comfortable for the client. need to remove your massage product. And now we are going to apply our facial mask. And, you know, obviously you're going to be choosing one based on skin type and needs. So we're going to, of course, apply our mask as we would all of our other things, avoiding the eyes, the nose, and the mouth. I'm going to use a brush to apply the mask. And then you want to, of course, follow those manufacturer's directions. You will apply the mask to the neck and the face. Once again, of course, just as I said, avoiding the mouth, the eyes, and the nose. And then, of course, based on skin condition, and then, of course, manufacturer's recommendations, all of those things come into play. That will determine how long you leave your mask on. And we're going to say for this particular mask, it would stay on her anywhere from 5 to 10 minutes, of course, based on her skin condition. So because we're doing the video, we're going to assume that that time has already passed. And so we can go ahead and move forward with mask removal. So we're going to take off the mask product now. her skin, of course, looks amazing. She will be thrilled. So now we're going to do our final tone. Once again, making sure that we're not going to come into contact with those two squares. And then it's time to apply her appropriate skincare. It's still sunny, so we're going to be, of course, placing eye cream first. We're going to do a teeny bit of eye cream, and I'm going to apply actually eye cream with my ring finger. And the reason for that is it's the most gentle of fingers. We're going to take a teeny little bit there on both ring fingers, and we're going to lightly tap it on the zygomatic arch and the brow bone. And then we're going to apply her moisturizer, and she is on the drier side, so we're going to be using a protective hydrating moisturizer that has a good sunscreen in it that is, of course, a physical block. We don't want her getting any any sunscreen. We want her in the best SPF. We don't want any sunburn. We want a great sunscreen. Can you tell I'm making a lot of videos today? Oh my gosh. So I'm just going to apply that moisturizer with SPF exactly where she needs it, which all over the face and neck. And then if it's going to be exposed, I would even take a little bit to that décolleté, ears, and just be very conscientious. We did discuss the importance of a sunscreen, and we kind of have a really good game plan of some home care basics that she's going to add into her routine to really support all this work that we're doing here. Let's give a little lip balm before we finish out, because everybody wants to leave with a gorgeous hydrated lip as well. And then we're getting ready to finish out our facial. And then we can present her lovely skin and show her how amazing she looks, and she's super impressed. So she is ready and willing to get this maintained with some good stuff. So we're going to give her some privacy and let her change back into her clothing so that we can meet her out at where we did the consultation at our work area in order to go over maintenance and aftercare. We're going to discuss the importance of some of that home care like we talked about, and she's going to go home with some key items, as well as going ahead and booking for her next service, so that we're really on the right track with hitting those skincare goals that she has, the skin health goals that she has. So we are good to go, and she feels amazing about it. So we need to get back to our room and take care of everything that needs to happen in there. The first thing we're going to do when we get to our room is we're going to toss any single-use items that we haven't already thrown away. They need to go. We're going to strip the bed, towels, all the dirty linen will go in a closed container until time to do laundry. We're going to grab any dirty implements, put them in a closed container labeled to be disinfected. Then we're going to identify and find a proper cleansing agent. We're going to read and follow manufacturer's directions for mixing and usage. We're going to obviously do that, and then we're going to wipe down and cleanse our work area, station, all of that to remove any dirt and debris. Then we're going to identify disinfectant that is bactericidal, virucidal, fungicidal, and EPA approved for use in a salon setting. We're going to read and follow manufacturer's directions there, so you want to grab some disposable gloves, because we're going to have to use those in order to read and follow those directions for mixing and usage and using or aerosol disinfectant can be used. And then we're going to disinfect any electrical equipment, store it in a clean area separate from other implements. And then you can take off those gloves and throw them in the trash, and it's time to do your final hand wash. So you're going to wet your hands at the sink coin-sized amount of liquid hand soap. You're gonna wash your hands down to your wrist. You're gonna wash the back of your hands down to your wrist. You're gonna wash your fingers, and you're gonna wash the backs of your fingers. You're gonna wash your fingertips and nails. You're gonna wash between your fingers. You're gonna wash between your fingers and your thumbs. You're gonna wash your thumbs, and you're gonna wash your wrists. And you're gonna do all of that interlocking washing for a minimum of 20 to 30 seconds. Once you've done that, you can rinse your hands thoroughly under that running water. When you feel like they've gotten that proper rinse, grab some disposable paper towels or a towel, turn the faucet off, dry your hands completely. Paper towels can go in the trash. If it's now a dirty towel, it can go in that container with the lid with the other dirty laundry until you can get to the laundry. Then you're gonna find your hand sanitizer, 70% ethyl alcohol. You're gonna sanitize just as you did with your liquid hand soap. Get it good, and then you know that you'll be able to either set up for whatever client you've got coming next, and you're prepared to do that. So this concludes your video for basic facial, and you can now move on to the next one.